We have a fantastic panel to wrap up the day here. This panel is going to start to take us from a more national look at healthcare issues and economic forecasts going forward to more of a, while still national, more of a look at states and local communities and some things that are happening in states across the country, some things that initiatives that employers are working on both the regulatory and purchasing front across the country and in specific states, folks that are policies that different states have tried to lower the cost of healthcare. There's a lot here this afternoon, and fortunately we've got about 2 hours to do it in. Now, just to convince you that you made the right choice to be here, I want to run through very quickly a couple slides that come from a poll that we just released last week. This was a representative poll of California consumers, asking them about their experiences in the healthcare system, some of their issues in the healthcare system, and what they would like to see policymakers in the industry work on in the next year or two. Not surprising to, I'm sure, a lot of you, and I know this is not going to be a surprise to Hemi, but when we asked folks, what do you think the governor and the legislature should work on specifically in 2020, there are a lot of things that they are asking their governors and their legislature to do. Improve public education, work on transportation, work on making housing more affordable. Certainly we have those issues, and folks want our Governor Newsom and the legislature to work on those issues here in California. But they also definitely are almost demanding action on healthcare and healthcare affordability in particular. When you add up the number of folks that say this is an extremely or very important priority for the governor and the legislature next year, you're north of 90%. Certainly 9 out of 10 people here in California would like the governor to prioritize doing something in healthcare. And I don't think that's going to be a surprise to Hemi, and she'll talk about what some of those healthcare issues are, like affordability, that other governors from around the country are working on. Fortunately, we have Rick Afable here on the panel today. Rick, many of you know Rick. He's a longtime friend of the Mirage School and certainly this conference. He's also the president and CEO of MindOC, a really innovative local initiative here that's trying to improve the quality and access to mental health in Orange County. Improving access to mental health is not only an issue or something that needs to be done here in Orange County, but certainly something that folks statewide would like to see action on. In fact, it's the top healthcare priority of Californians. When you ask them specifically, what would you like the governor or the legislature to do within healthcare, increasing access to mental health treatment and coverage is number one. That's no surprise, I'm sure, to Rick. It speaks to the magnitude of the problem, and we're really fortunate to have Rick here today to talk about what he and his company are doing in Orange County to increase access to mental health treatment. We're also fortunate to be joined today by Elizabeth Mitchell, who is I will still call a brand new president and CEO of the Pacific Business Group on Health. Elizabeth can introduce PBGH, but many of you already know they are a coalition of large employers that are either based here on the West Coast or have a large base of operations. Employers are very, very engaged in healthcare for a number of reasons. I think the simplest is despite some erosion in employer-sponsored coverage over the last several years, employers are still the predominant way that most Americans get their coverage, and that holds true within California. And the many problems that are in the healthcare system fall to the purchasers of healthcare. And so Elizabeth will talk about some of the purchasing and policy initiatives that they're engaged at the national level, as well as maybe a couple things that they're working on here in California. And then finally, we're very fortunate to be joined by Chrissy Eibner from the RAND Corporation today. Chrissy and her team at RAND have spent the better part of the past year putting up with us at the California Healthcare Foundation and talking with numerous stakeholders across the state about state-based approaches to cost containment. The reason we asked Chrissy and her team to do that is in this poll that we released last week, as well as many other polls that we've looked at over the years, cost and the cost of healthcare is almost always the #1 issue to Californians. The data that we have that just came from the last poll are actually pretty striking. This is not just folks that still don't have insurance in California. It's actually the insured population now. More than half are telling us that they're foregoing medical care or dental care or mental health care due to costs. And what's particularly striking is when you ask those who did postpone or skip care, 43% said it made their condition worse. That is striking. That is a striking statistic, and I think it speaks to, what it speaks to is healthcare costs have become almost a public health issue here in California. And so Chrissy and her team have done some work surveying the landscape of what other states have done, either through regulation or legislation, to try to change their healthcare system to address specifically cost issues. With that, I'm going to stop. We'll turn it over to each panelist. Each panelist will have about 15, 20 minutes to talk about, give us their perspective on emerging issues and initiatives. And then at the end, we'll do some moderated Q&A. But please join me in welcoming Hemi Tewarson from the National Governors Association.